I want to go to my first guest, Bernadine Kirby, and she is an independent insurance broker, health insurance broker here in Fresno, and we're going to be talking Medicare today. Thanks for coming in.
Thank you. Thanks for having me.
So, Medicare, Obamacare, a lot of things going on in the insurance market right now.
Yes.
Health insurance is becoming one of the most talked about, one of the most complicated subjects.
Yes.
And for some of us that are easing up there in years, without disclosing too much about myself, we have a lot of things going on. So why don't you lead off by just talking about the Medicare program, kind of in general, and then we'll start talking about specifics.
Okay. One of the biggest myths, I think, and I get asked all the time, what does Obamacare, how is that impacting Medicare? Obamacare is for 65 and under. Medicare is 65 and over. So it hasn't really impacted Obamacare hasn't impacted Medicare yet. It's still the 65 and under. Medicare is a program that if you are 65, 3 months before your 65th birthday, you should go to your Social Security office, get your Medicare A, and you apply for your Medicare Part B. Your Medicare B is what you pay for. It's $105 a month starting January. That's what it's going to be. Actually, it's $104.90. And your Medicare A covers your hospital. Your Medicare B covers everything outside of the hospital. That's the difference between the two. And your Medicare C is your supplemental plans, your HMO plans, your special needs plan, and your Part D is your drug plan.
Okay, so there's a lot to it.
There is a lot to it, and it's very confusing. I had somebody call me last week that said, yes, I want to go through my Medicare A through N. Well, he was getting a supplemental mixed up with his Medicare. So Medicare itself is just your Part A and your Part B, and if you look on your card, it'll tell you Part A is your hospital and Part B is your medical. So it kind of lists it. That's what's on your card.
Okay. Now, what is the premium on Medicare A?
Medicare A, for the most part, everyone gets it for free, and for the most part, everyone gets Part B for $105. But I have clients that pay up to $700 for their Part B, depending on their income. Mm-hmm. And your Part A is the one that you get for free. It's not a pay for the most part unless you haven't lived in the United States you have to lived here 10 years or 40 quarters to get your Medicare.
All right. Now, when the day approaches for that 65th birthday, which thank God is just a little bit less than 5 years from now. There I went. I let the cat out of the bag. Yeah, I'm 60. Anyway, okay, now you sign up for the Medicare, but you still need to have other insurance besides that, right?
Right. What Medicare is, what it's been, and when it first started, it was great. It's an 80-20 split. So if you have straight Medicare, your A and B, Medicare picks up 80%, but you pick up that 20%. And in the 60s, that was a pretty good plan. In 2000, it's not such a great plan if your bills are coming up to $30,000, or if you God forbid, get cancer or something where you're, having lots of medical problems. It could be that 20% could be really high. So what they did is they had the supplementals where you could get extra coverage for that 20%, but then on a supplemental, if you had any prior existing medical conditions, a lot of people couldn't get it or they couldn't afford it. So that's why they have Medicare Advantage now.
Okay, and then the Advantage program, puts the supplemental in behind?
No, it's a different program, but Medicare Advantage is, a lot of them are zero premium, so you can still get the coverage without a large premium. Mm-hmm. And the only thing medically they can ask you is if you have end-stage renal disease or if you're on kidney dialysis. Mm-hmm. That would be your only medical determinant not to get on it. Mm-hmm. On the supplemental plans, some of them are 8 pages long, so they can deny you coverage for whatever reason they want to.
Okay.
So that way, you at least have something you can get for that 20% if you could do Medicare Advantage.
Okay. Well, I'm going to be bombarding you with a lot of questions.
Okay.
Okay.
All right.
Medi-Cal. Where does Medi-Cal fit into everything?
Medi-Cal is a program set up mainly for if you have low income. So if you have Medicare, you can have Medicare, Medi-Cal. Medi-Cal picks up the 20% just like a supplemental would, only you're not paying for it for the most part.
Okay.
And there are some programs out there for those of you that it's called the Extra Help for My Drug program. A lot of people don't know about this. I don't know why, but if you go call Social Security or Medicare and ask for the application, it helps with the cost of just your drugs. It has nothing to do with anything else. So if you're struggling with the cost of those drugs, try calling your Medicare or Social Security office to get on that program, or at least get an application. The worst they can say is you don't qualify.
Okay. Now, when somebody signs up and you already have some insurance in place, and then you have Medicare. Now, do you drop your other insurance, or you keep your? Say you have a Blue Cross, Blue Shield policy in place when you're okay, and then you turn 65. Now, do you continue with that insurance also?
No,
or?
you would probably, because once you turn 65. It changes and you're on Medicare. You can certainly have a Blue Cross policy, but it won't be the same policy that you had because all of the rules change, and the cost should go way down.
Okay, so it'll drop.
Help you, yes.
Okay, at what point now? Once you're in the system, is that where you stay?
For Medicare, or
yes.
For Medicare, yes.
Okay. It's not like it sunsets, like all of a sudden when you turn 70, you have to switch to something else.
No. Medicare is the program that's going to stay with you forever. That's it. Once you turn 65 and you're eligible for Medicare, then yes, it stays with you. You don't need to change to another program.
Okay. Now let's. Now, do you deal with other types of health insurance also?
I
products?
did. I don't anymore. I only do Medicare. I was dealing, before Obamacare came in, I was doing for my clients, I would do their spouses if they weren't 65, or their nephews, nieces, and then I stopped doing that once Obamacare came in, and just, these things change all the time, so it's really a lot of work to keep up with everything that's going on with Medicare. So I concentrate on that so I know exactly what I'm doing and how to best deal with my clients and make sure they're getting the best product for them.
Okay. Well, and then on the Obamacare side now, there's still a tremendous amount of confusion.
There is a lot of confusion, yes.
Nobody really knows what to do.
Right.
What you're going to be able to keep.
Right.
Do you want to expound on that? Because you've worked in the industry.
I did, and I can only talk about my experience because I have a 23-year-old daughter that was going to school in Chico, and having her on our insurance was really expensive, so I was waiting for Obamacare. I thought, oh, good, she's a student. I'm going to be able to get her on Obamacare. So when it first came up, I went through the whole process that really took a long time. I'd say about an hour. And then I still didn't really understand what it was, and I finally got in touch with somebody. It took me about 2 weeks to get on the phone, because, again, I did this when it first came out. And they asked me, well, do you pay... is she on your taxes? And I said yes. And they said, okay, well, we're going to take your tax income and we'll tell you what you have to pay for your daughter to be on Obamacare, which was outrageous. It was over $600. And I thought, well, certainly that's not helping me. So I went and just put her on a regular plan. I just went through the process and thought, okay, she's 23, and just put her on a plan, which, still cost me a lot of money, but not what it would have cost me to go through Obamacare. And so that's my personal experience.
This is what's so frustrating for everybody right now. I'm kind of the small government type to begin with, so I always viewed Obamacare as a nightmare before it started, and now it's starting to unfold because the whole idea behind this was Affordable Care Act,
right.
And it's anything but affordable.
Right. And it may be work for some people in some groups. I don't know. I only know from my experience that it was pretty much a nightmare and didn't really work for me.
Well, and it backfires. It kind of I don't know if Bill, do you still have that clip for healthcare DMV style?
Oh no, I don't. Sorry.
Yeah, I'll have to bring that in. It's just really great because it's kind of how it's unfolding. Because what's happening now is when the act was passed, they claimed we must do this, even though we're not sure what's in it, because there's 27 million people in the United States that have no health care insurance.
Right.
They would use the semantics of they don't have access to health care, which is not true, because everyone gets treated one way or the other.
Right.
And now the number is pushing over 50 million
So
because of all the gaps and everything else.
And there is a lot of gaps, and there is a lot of confusion, and people still didn't know, how do you do this? Because Obamacare for California, it's Covered California. That's the name of the program. So you can go onto the website and go to Covered California and go through their process there. And when I was doing it, there was a telephone number there, but it took me a couple weeks to finally get in to talk to somebody. So that's probably eased up a whole lot, because like I said, I was doing this when it first came out.
It's that personal touch, like the DMV.
Right.
That's what it is. So anyway, okay, real good. Before we go to the break, just let our viewers know what are the things they need to do and the traps to avoid when they're approaching.
Well, right now, we are in open enrollment, and everybody should be aware of that. It's from October 15th through December 7th, and that's when everybody has the opportunity to switch what plan you're on now, to go to a Medicare Advantage, to go to a Medicare Supplement, to change your drug plan, and just really want to go over the drug plan just a second. Go to Medicare.gov or call Medicare and have them review your drugs. It's kind of the best way to get on a drug plan. It'll really save you some money.
Okay, very good. Well, thanks for coming in today. This has been very, very helpful, and you are in the neighborhood here, and so we're going to, as things unfold, we're going to be pulling you back in for another Healthcare Part 2. Okay, folks, we're going to be right back after these messages.